94.3 WYBC, the rhythm of the city. I'm Daryl Huckabee along with Dee Dee in the morning. Now, we're always keeping you connected to what's happening in the community, especially when it comes to health and wellness. And last month, we had one of the co-chairs of the Black Maternal Project join us to talk about their 5-part webinar series, part 1 of which happened last month. Now, part 2 of that webinar series is happening this week. And joining us today is the other co-chair of the Black Maternal Health Project. She actually has a lot of titles. She's a former mayor of New Haven, and she's also the president of the New Haven chapter of the Links. And I'm talking about former Mayor Toni Harp. Good morning. How are you?
Good morning. How are you?
I'm fantastic. Glad to have you join us to talk about this fantastic webinar series that you all are doing, a collaborative between a few organizations, really talking about Black maternal health. And part 2 of the webinar series is happening this week, Wednesday. And for people that want to register, you can log on to Eventbrite. So tell us about what's happening this webinar coming up, the topics of discussion.
So, one of the things that we want to do is to make sure that women are prepared for pregnancy. And oftentimes, women may have a chronic condition that may impact their pregnancy, but they may not be aware of it prior to them becoming pregnant. And even after, sometimes their OBGYN may not bring it up in time for them to intervene so that it doesn't impact the pregnancy. So this webinar is going to be about managing chronic conditions to help people understand what they are, because sometimes folks don't really know what they are. The kind of pre-screening that as a pregnant woman or someone who's going to be pregnant needs to have to make sure, one, they don't have chronic conditions, but then if they do, how do you manage them to make sure that you are healthy as the mother and you have a healthy baby? The other thing that we're going to talk about is sickle cell awareness. Years ago, when I was a young woman prior to being married, we were required by the state of Connecticut to be tested for sickle cell. That's not necessarily what happens today. I think that when babies are born, they're actually tested, but you really need to know before, so that if there are things that you can do before with your partner to sort of mitigate that, to inform your provider, that's important. But we're going to hear about the progress that's been made with sickle cell disease. And so we're really excited about Dr. Janice Nelson coming to talk to us about that.
Awesome. And she is one of the guest speakers, along with Dr. Jamil Harp, who is your daughter, and Dr. Cynthia McCraven. And again, planning is an important part of pregnancy. And I think a lot of people take that for granted in terms of the preparation and just being knowledgeable about certain health conditions, which is why you guys created the Black Maternal Health Project, to create that awareness, correct?
We wanted to create the awareness. We wanted to help to empower young women who may become pregnant or are pregnant to intervene in a positive and productive way with their healthcare providers and also with their environment. And so we're hopeful that the work that we do will make a difference, will reduce the evidence of what we see as high levels of maternal mortality, particularly among Black women, that has been ongoing. I remember when I was in the General Assembly 20 some odd years ago, we had in our community, certain neighborhoods in our communities here in New Haven, infant mortality rates that look like third world countries.
Wow.
It's just gotten worse. And so what we've learned, because we have done a lot of work on infant mortality, reduce those numbers. But when the community gets involved and they understand these are the things that you're going to be impacted by, and they demand change of themselves, but also of the systems that they engage with, then change occurs.
Right. Knowledge is power. And that's the most important thing, getting the knowledge out there, making people aware. And that's what honored that you guys are doing and helping the community. And again, we're talking to former mayor of New Haven, Toni Harp, who is the co-chair of the Black Maternal Health Project. Again, part 2 of the 5-part webinar series is happening this Wednesday at 7:30. You can register on eventbrite.com. And then at the end of the 5-part webinar series, which concludes at the beginning of next year, in the spring of next year, you're having a symposium to bring it all together, correct?
Yes, we are. We're so excited. Our partner is Southern Connecticut State University. I've got to say that President Smith has been outstanding to work with and to link with our community, and I believe he does it with others as well. So we're really excited to be there again for the second year, and we're going to bring everything together. We're going to talk about how to prepare for pregnancy once you're pregnant, how to negotiate the system, and then how to advocate for others. So this is going to be something that will also provide continuing education credits for social workers, nurses, and public health professionals. And so we're hoping that all of them will come out and will really support this initiative to make change in New Haven on behalf of our mothers and their children.
Awesome. And again, for that event, as well as the entire 5-part webinar series, you could register at eventbrite.com. Part 2 of the webinar series, again, happens this Wednesday at 7:30. And looking forward for everybody from the community to really join in and participate, get the knowledge, and be more informed about Black maternal health. Former Mayor of New Haven, Tony Harp, thank you for joining us, and co-chair of the Black Maternal Health Project. Thank you for joining us and sharing the information today.
Well, thank you so much for having me, and thank you for being the voice of the community. It's so important, the work that you do, and we're really pleased that you have basically highlighted our program. And yes, come on out, everybody.
Absolutely. Thank you so much. I'm Daryl Huckabee, always keeping you connected to what's happening in the community, especially when it comes to your health, with Dee Dee in the morning on the Rhythm of the City, 94.3 WYBC.